In the end of the day, when you have a treatment and there's a patient and there's a provider, they have to be on the same page. If the patient has a vision and it's one way and the provider has another idea of beauty and it's not matching, that's where you're going to get the mismatch. That's where you're going to get the dissatisfaction.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Tsay here of Aegis MD. He is a former ER physician and is featured among California's top medical professionals. He is a sought-after international speaker and trainer for many of the latest dermal laser technology methods, and is also known as a trailblazer for elevating the field of PDO thread lifting in the United States. He is the owner of Aegis MD, an aesthetic and anti-aging clinic in Orange County, California. Dr. Tsay, glad to have you here.
Thanks, Daniel. Thanks for having me.
Yeah, so let's dive right into it. I'm curious, how did you actually get interested in the aesthetic space?
Well, I've always liked beauty and skin. In fact, this is my second career. I did 20 years in emergency medicine and later transitioned into aesthetics. But I still remember, and my colleagues remember this, when I was doing my internship here right after medical school, I was peddling skincare products. I was selling skincare products, and I was speaking on I was speaking for this skincare company, and also selling skincare products while working in the ER as well. So it was interesting that I've always had that in me. I've always liked skin and beauty, just never knew how to get into it. And 20 years later, here I am, 28 years actually.
Man, so Dr. Tsay, can you discuss some of the most popular treatments that your patients come to you for? And also, why do you think they're the most popular ones?
First of all, I am known for thread lifts, but still bread and butter is still your mainstay is injectables, which is your botulinum toxins and fillers, just because that has been around for the longest, right? Thread probably made a big comeback in 2014, 2015. But Botox, FDA approved 2001. I wish I would have gotten into this business then. Fillers have been around since early 2000s, so it's been in the market much longer. And so there's more widely accepted for the injectables, and then also the lasers have been around, or it has a resurgence as well. So I do quite a lot of lasers and energy-based devices.
Got it. Okay, now, what do you think, are there any new or emerging treatments that you're particularly excited about?
I think just the whole non-invasive space is quite amazing. Like, there's just a lot of explosion and growth and innovation in the non-invasive space. And more people are looking for non-invasive treatments. They're looking to prolong that time that they need to get that facelift or that neck lift or the eyelid surgery. So with that being said, there's a perfect niche for a lot of the stuff that I do, which is mostly non-invasive, that bridges that gap where they feel like they're too young to undergo a major operation or surgery or under the knife, yet they're seeing some changes that they want to address.
Okay, now that's actually a perfect segue for my next question then, is for people who don't understand the difference, how would you describe how a medical spa differs from your traditional cosmetic surgery practice?
Cosmetic surgeons have been around. Like they were part of like the core, which originally it was dermatologists and plastic surgeons. And now we have regular MDs that are in variety of different, that may have started in a variety of different fields, to physician assistant or physician associates, registered nurses, some states dentists, some states estheticians that are now in this space. So I would say the traditional cosmetic surgeon, focuses more on the invasive treatments, the liposuction, the facelifts, things like that require like an operating room, like a procedure room, a surgery suite, etc. The more medical spa, it's more of a is a hybrid between, it is a medical procedures that are being performed, but it's an upscale spa, enjoyable, relaxing experience, similar to what you get like going to a massage spa or, or like a nice, high-end hotel that has a nice spa. So
Yeah.
that kind of environment merged with cosmetic procedures that may have, some needles and some technology behind them.
Okay, so it's almost like a combination between that traditional massage spa and the plastic surgery. Combine that together, that's more the med spa.
Yeah, but the interesting trend is before, where the plastic surgeons were just focusing on their surgery, they're realizing that with all these medical spas popping up, that they're losing out on a big opportunity. So what I'm seeing is a lot of plastic surgeons have their surgery center, have their plastic surgery office. They also have like an adjacent wing where they do their med spa services. So they're wanting to capture those non-invasive procedures. So, because it's a growing, trend right now. So they don't want to miss out on that. And they typically hire, like nurse practitioners or PAs. Some even do it themselves. Like the few plastic surgeons, they'll do their surgeries, but they'll also do their injections and their other like thread lifts, etc. But I would say most of the time, the plastic surgeons do delegate those procedures to like a mid-level practitioner or like a nurse, etc.
Okay, got it. Now, what are some of the most common misconceptions that people have about the treatments that you offer?
Oh, there's so many misconceptions. I could go. I mean, there's a lot, but I would say, probably the most kind of like surprising question I get a lot is this permanent? So I would like to address that by saying nothing in life is permanent, right? Our life here on Earth is not permanent. I know it sounds very depressing, but nothing is permanent. Even if you get surgery, like even if you get a facelift, that should last you about 8 to 10 years. It's not permanent because our body still undergoes the aging process and we still get older. So things are going to change within the body, but it's not permanent. Another common misconception is that just because you're getting Botox and fillers, that you look like, Beverly Hills housewives, etc. That's a big misnomer. In fact, I would say that's usually the minority of cases. Some people do like to look a little overdone, but just because you get injections, it can look completely natural. And I tell patients this: for every one patient that you see that you look at them and you go, oh my, they've had a little too much fillers. There's 10 more that you walk by on the street that do get Botox and fillers and injections done or procedures, and you would never know because they would not tell you. And they look completely natural because they haven't caught your eye. They don't, they look like a normal person. And that's what it should look like. I mean, in our space, what we deliver is we try to deliver, help patients look like a better version of themselves, not to change their look or make them look like someone different. So that's a big one right there.
Okay. And have you seen, when it comes to, I'm glad you brought the natural looking part. Have you seen that that's become more and more of a focus, that people, when they come in for getting these treatments, they want more and more focus on the natural? Or have you seen that it's always been that way, just maybe like in the media has blown that out of proportion where, oh, if you get this done, you're going to look unnatural?
Well, I think as we get more mature in age, we do want to look a little bit more natural. I think the younger generation, the millennial, Gen Z, etc., they have a different perspective. They look at other folks on social media through filters, etc., that are not realistic. And sometimes they get a little, distorted perception of reality, and they think that's reality, and it's sometimes, most of the time, it's not. But I would say more of my mature clients, people that are, more mature, not in their 20s, not in their 30s, but a little bit more mature, have a more realistic expectation of beauty, want to look more natural. And some of the younger folks, they may want to like alter their appearance or try to look like someone they're not, except like through a filter.
Yeah. I'm sure you've gotten some people coming in with the filter look, is like, I want to look like this, right?
Absolutely. We get it all the time. And you do have to be realistic with the client and just make them realize like that's a filter, and I can't give you, I can get you close, but we're not going to make you look like that's a filter, because it's not real. Yeah. Okay,
got it. Now, Dr. Tsay, I want to talk about what differentiates your practice from others in the industry, specifically you being a speaker, you being a trainer. Could you talk a little bit more about that, like how you got into that speaking, teaching, kind of where it's taking you all across the world?
Yeah, so I started early on. I was fortunate to get invited to learn from, there was a group of plastic surgeons from Korea that came way back in like 2015 and trained a small group of people on PDO threads. And from there, I started using it. I wasn't good at first, and you never are. The PDO thread lift is a big learning curve. And so I was just very persistent. I didn't take no for an answer. I didn't want to accept that, I can't do this. It was hard. It took a lot of work, a lot of practice. And eventually I didn't give up. And eventually I started becoming really good at it, to the point where they invited me to become a trainer and then a speaker. And then, through social media and through being on stage, the other companies start to see that you're doing this. And then they start inviting you to speak for them or train for them. And so then it just kind of snowballs. And now, I travel and teach both locally and internationally. But what really sets us apart is that I'm constantly looking for the latest and greatest. I mean, there's always something new. There's always something innovative. And as soon as you stop learning, that's game over, really. I mean, in terms of your competitiveness in the space, it is very competitive. I mean, in my med spa alone, in my city, at my location, I mean, there's 7 med spas within like a bicycle ride of my office. So you do have to stand out. And I think standing out involves being innovative and being in the forefront. I mean, I spend, tens of thousands of dollars every year traveling, not just speaking, but I'm traveling different places and just trying to learn to see what other people are doing, and maybe learning something new that's innovative that other people in other parts of the world are doing that we're not. And then that gives you ideas. And from then you kind of experiment and you start doing things maybe differently, and sometimes coming up with new procedures itself.
Okay. Now, when it comes to the training side of it, if you had to make a guess, how many other practitioners do you think that you've trained or spoken to in all the time that you've been being out there and being an educator in the subject?
Oh, I can't even count. It's been years now. It's been years. I mean, you host trainings every single week. I mean, every single, like two to 3 times a month. And then, when I go on stage and I'm doing a demo, I mean, that's part of the training too, because the people that are watching me on stage, I'm giving them tips and pearls. So it's really hard to count. But I've been training for quite some time. And it's funny because I want to share you a funny story. And I'm not saying this to brag, but there's a thing that I got voted into. It's called Top 100 Injectors. I used to think that this was, you had to pay some money to get selected, or it was just a big popularity contest, right? So, who's more popular on Instagram? Oh, they have 100,000 followers. They're the ones that are getting selected with the top 100 injectors. And for years, I was, when they had their votes come in, I would ask my patients, ask my friends, please vote for me, top 100 injectors in the United States. And I never got it. Year after year after year, I would solicit. And then last year I said, screw it, I'm not going to participate. Okay, they're voting. It's a popularity contest. I'm not paying them anything. I'm just going to sit back and chill and ignore this whole thing because it's not important. Well, then they picked me and I got selected top 100. And I was talking to the people involved, and I was like, how did this happen? I'm not popular on Instagram. I don't have 100,000 followers. And they said this, it made a lot of sense. They said, because you're a trainer. Because you're a trainer, and people typically other injectors will vote for who trained them. So going back to your question, how many people are trained? I don't know, but I must have made an impression on some people that they remembered me, and when it came time to vote for their top favorite or top injector, they voted for me and I got picked. So it was a cool story. Now I believe in it because I know I didn't pay a single dime. I didn't solicit any votes, but I got selected. So
yeah, I think that's a fantastic story, especially when it comes to when people are looking for who to go with, who to choose to do their treatments. It's, they want to go to the master, someone like yourself who trains other people. So and I've spoken to other practitioners across the country who are in a similar situation. It's like, well, when they're talking to their clients and the clients maybe have some reservation, it's like, yes, and well, who do you want to go with? Do you want to go with the master or do you want to go with the student? So I think in your situation, it's like you're the master, you're the one that people are learning from and being trained by. Now, you talk a lot about the educational part of it, ongoing education for yourself and being able to give that better service to your clients. So how would you explain how you approach educating your clients about the services and the benefits of it? I'm sure we talked about some of those misconceptions. How do you approach that education to them and maybe overcoming some of their misconceptions?
Yeah, well, we do when they come into the consultation, it is very thorough. It's very individualized. And a lot of times it's really for me to get in their brain and understand where they're at. Everyone's different. I'll give an example. Some people may be more open to more invasive procedures. Some patients may have had their Botox and fillers and lasers and be very seasoned at getting procedures. Some patients never had their face worked on. They never even got a facial. So the way I'm going to approach either of those clients are going to be very, very different. So it is a conversation, and it's an opportunity for me to get a feel for where they're at in their journey. Maybe they're very timid or afraid of pain. So I'm going to pick something that's a little bit less invasive, that's a little bit less painful, versus something that someone has done a lot of procedures and they want the best, they want the most aggressive treatment possible. I know that I can deliver that to them. Also, there's a lot of visual aids. I do showcase my work when they come to see me. And when I first started, I remember I didn't have any before and after. So I had to show whatever the companies like Allergan or Galderma, I got to show their portfolio, which wasn't my work. And that's almost misleading because you're showing other people's work, but that's not your work. So it took some time, and that took a while to gather my portfolio. So now I have a portfolio of my before and afters. It makes it a lot easier to show people, and it's more sincere. You're like, these are before and afters. It's not from Joe Schmo plastic surgeon. It's from my office here. These are my patients that you saw, these real results, and they're real results from real people. Also, for example, when I do thread lifts, I like to get the patient's tactile feedback as well. So I have threads in the office. They can touch it, they can feel it, they can feel the cannula, they can see it, so they know what's going to happen once they go into the room. Likewise, I do different lasers, and the lasers are there. They can see the laser systems. So they get to really experience and understand a little bit more. And I think that eases their anxious and their anxiety sometimes before going into procedure, because they already know what to expect.
I think that's perfect, because you actually kind of answered the next question. I want to go a little bit deeper as far as how you're able to provide that relaxing experience, but also ensuring their safety and well-being. Because I'm sure you get a lot of people that come in, and you mentioned that they haven't had nothing done. So they're, I wouldn't say skeptical, but they're very maybe nervous about how the whole thing goes. And it sounds like you basically walk them through, hey, this is everything that's going to go into it, so that they're a little bit more relaxed, they're a little bit more loose, and they're not so on edge, but you're still making sure that they're well taken care of during the treatment. Is that correct?
Yeah, that's important, but there's also a secret sauce on top of all that. It's called laughing gas. We carry a thing called Pro-Nox, which is nitrous oxide and half oxygen, and it's basically laughing gas. It's diluted laughing gas, but they still get the laughing gas experience. They're dissociated, but they're still there. They're awake. They're fully conscious, but it just takes away the ease and anxiety. It doesn't take away the pain, but they don't care as much about the pain when they're going through any sort of painful procedure. It's like, oh, that hurt, but I don't care. But it does put them at ease, and so that's been a big part of our practice, the laughing gas.
Okay, got it. Now, Dr. Tsay, you mentioned before, like, you've done a lot of the education side. You've tried different things to really hone and refine your technique. So what would you say, what role does creativity play in the approach that you bring to these treatments?
So yeah, great question. It's in the days when I was developing some of the newer techniques that I do, I would schedule what I call play dates. What that means is that there are days that I schedule patients that and I may give them a discount, or sometimes even do a complimentary, where I basically try different things. I'm still doing like the bread and butter procedures, for example, the thread lift. I may do a thread lift, for example, but I'll try a different vector here and there. I may, I'll use the traditional vectors that I do, but I may put in another vector that's a little bit different, and I try different things. And so by doing that, sometimes I was able to discover new ways of doing things, and also, be innovative and creative. Sometimes they worked, sometimes they didn't, but at least I was able to try different things and to try new things, and even possibly discover new ways of performing certain procedures.
Got it. Okay. Now, I'm sure you've had a lot throughout your career, some particularly challenging cases that you worked on. So would you mind sharing maybe a story or two of some of these challenging cases and how you were able to turn around and get a successful outcome out of it?
I would say, some challenging cases. I'd like to share maybe like some of the cases that really are challenging for the patient, but also are so significant and so impactful that I call it my tearjerker procedure. So I've got two major procedures that I call my tearjerker. What I mean by that is, after I do these procedures, when the patient picks up the mirror and they look at themselves in the mirror, the tears just flow. And to realize that you had that much, I mean, to me, it was like, oh, I just did this and did that. And, I do this every day.
Mm-hmm.
It's so mechanical and robotic for me. But for them, it just, that whatever I just did for them changed their lives, where they're just crying in the chair. And to me, that's really, really powerful. So two things. One is the nose.
Mm-hmm.
Sometimes when I do fillers or threads in the nose, and I can correct, like sometimes I can correct a deviation. Sometimes they have a hump on their nose, something really mild. But to them, it was, one of the most important things in the world, because they had some childhood trauma associated with, maybe someone said something when they were young, maybe someone picked on them. So it really affected their self-esteem. The other procedure is acne scars. Acne scars are really tough. They're challenging for the patients. A lot of patients have spent a lot of money doing various different things that may or may not have worked. A lot of times they've given up, and then they find me, and then I have some really cool ways of addressing acne scars that really makes a big difference. And again, once they pick up that mirror, the tears come down. So that gives me a lot of gratification. A lot of times when the things that I do, that I can really have such an impact on my patients.
Mm-hmm.
It really makes me feel good, and really makes me look forward to going to work every single day.
Yeah, that's amazing. That's amazing. Is there any case, like one or two people in particular, that really kind of come to mind that fit either of those two scenarios that you described?
I don't have any specific stories, but the same storyline. Either something that they were insecure about, something that they got picked on when they were younger, something that they've always didn't that really bothered them since they were young. I do have one particular story that comes to mind. It was not really vanity. There's this patient, she had some sort of medical condition. I forget the name of it, but it caused her cartilage in her nose to basically disintegrate and rot. So her nose is deformed, and it was deviated, it had a big divot, and she walked like, with her whole life with that deficit, not knowing that there was anything that she could do. Not being able to afford any major surgeries or reconstructive surgery to repair it. And when she saw me, I was like, oh, I could just put a little filler, blend it in, and make your nose look pretty straight for the most part. So I kind of restored her nose like 98% back to a normal looking nose. And she had no idea. She was just blown away, just couldn't believe that this was even possible without surgery. Because a lot of people think, oh, I got to get surgery to fix this. And sometimes it's just an easy non-surgical fix.
Yeah, that's incredible. That's a very powerful story, because I think that's something that people don't realize. Like, if she thought this, I'm sure tons of other people think this. Like, oh, I have this thing and I need major surgery to fix it. They don't know that there's another solution out there for them that's not as invasive or requires as much financial commitment to it. And so I think that's a fantastic story that you just described, for people to understand that their situation, there may be another solution. Now, so Dr. Tsay, I'm curious, where do you think the future of aesthetics is going?
I think, we have ups and downs and different trends. And right now we're seeing a little bit of a downward trend in the filler market. And you can, talking to my reps, I mean, it's, we're in September 2023. Right now we're seeing stories of celebrities getting their fillers dissolved. So that's driving that slightly downward trend in fillers in general, especially hyaluronic acid fillers. Most fillers are made of hyaluronic acid, which is, it gives you an instant poof. You see the result right away. What I see the trend going is in the field, what's called the biostimulatory. So it's still a filler, and we still are, you still need volume, because patients, as we age, we lose volume, we lose our fat pads. So we still need volume. But if they don't want to do fillers, you can do what's called biostimulatory. What that involves is we put something into the skin that causes your body to grow its own collagen. You can also inject something in your skin. There's a product out there called Renuva that you inject in your skin, and it grows, or underneath your skin, and you grow your own fat. So these are very powerful tools that gives you volume in a natural way, because the end result is your own collagen, right? With the fillers, you inject some Voluma or Juvederm, and yes, you look great. It's an instantaneous pop on your cheeks or your temples or wherever you put it, but it's still it's a gel. And, it may not be as natural as when you volumize, but when you touch it, it's your own body, it's your own collagen, it's your own fat. So I think that's very powerful. And I think that's a huge trend right now, because you're starting to see some of the biostimulatories go up while the hyaluronic acid fillers are going down in sales.
Okay, so it's more just the technology is replacing it. Everyone's still looking for it, but it's just taking a different form.
A different way, a different form, and a more natural form.
Got it. Okay.
And one more trend I would say is probably, have you heard of the regenerative aesthetics, which is
it's starting to get more popular.
Exosomes. I think the exosomes are becoming a big trend in terms of skin. There's going to be more applications of this. And right now we're using it in microneedling, energy-based devices. We're applying the exosome topically to regenerating your own collagen, regenerating your own elastin, because we lose elasticity in the skin, and also with wound healing, and it has anti-aging properties. So that's another big trend coming up.
Okay, got it. Well, thanks for sharing that. I have one last question for you, Dr. Tsay. But before I ask it, I want to point people to your website at www.ageless-md.com. Now, last question is, what would be the most important piece of advice you can give to someone who's maybe on the fence about getting some type of aesthetic procedure done? Maybe they've never done it before. Maybe they've had these certain misconceptions about what goes into it. But what type of advice would you give to someone like that?
Sure. Number one, you should, if they have social media, if they've done any video, you should get to know the person. I mean, you should be, any patient should be comfortable with their provider. The provider, if they have a photo, look at their face. I know this is shallow, but that can kind of give you an idea of their idea of beauty, because ultimately, at the end of the day, when you have a treatment and there's a patient and there's a provider, they have to be on the same page. If the patient has a vision and it's one way, and the provider has another idea of beauty, and it's not matching, that's where you're going to get the mismatch. That's where you're going to get the dissatisfaction. But I think when you have a patient provider that sees eye to eye, they have the same standards of beauty, and you can get some ideas, but again, by looking at their social media profile, looking at their before and afters. If they do a lot of procedures, they should be posting their work online, not other people's work, but their own work. And so you can see the before and afters and get an idea of, what kind of work do they do? And then go to get a consultation, because if you talk to them, you can get an idea of their personality, and just make sure that you feel comfortable and that your visions of beauty do match.
Okay, great advice. Thank you for sharing your expertise, Dr. Tsay. Now, where can people contact you in your practice?
Sure. Our phone number is 714-760-9918. You did give them our website already, so that's available. And then we do post a lot of our most current before and afters and videos and technologies on our Instagram. So it's ageless_MD on Instagram.
Okay, perfect. Well, again, thanks for being on the show, Dr. Tsay, and sharing your message.
Thanks a lot, Daniel. Thanks for having me. Talk to you soon.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.